rather interesting to me that actually when you look at the randomized placebo-controlled trial results of the last 4 or 5 drugs that have been approved by the FDA, the magnitude of the effect, the percent dropouts due to adverse events and other things can't really predict how impactful the drug is going to be on the market, in the marketplace. And sometimes that's because the patients that we expose in clinical research are not the patients that ultimately will be using the drug in clinical practice. But having said that, the data support a significant number of patients not only having a reduction in seizures, but having complete seizure freedom over some prolonged period of time. And as epileptologists, that's quite exciting to us, because the number of patients who actually become seizure-free is relatively small in any of the cohorts that go into clinical trials. Again, how that's going to translate into the clinic will be very interesting, and we'll be watching very closely, but it's a good first indicator that there may be some substantial impact in the treatment-resistant patients. On the flip side, we have to be mindful of the 2 things we know about the drug that are going to make them more difficult in the clinic. And number 1 is that, as with other drugs that cause hypersensitivity syndromes, one has to have quite a long titration period. And that's frustrating for both the doctor who has to write out the prescriptions for all the titration, as well as the patient who has to wait some period of time before they get to a dose that's going to help them. And the second thing is that doctors need to be mindful of the hypersensitivity syndrome itself, should it occur, in terms of rash or serious rash. And certainly that is something that is always worrisome to us as clinicians. It means that we have to keep a close eye on our patients. So that's the downside, to go with the upside that if you're cautious and you have patience, that eventually you will get to the point, it appears, where patients can see a substantial benefit.